Good afternoon, everybody, and this is Kinesiology 220, First Aid. Today we're going to be going over CPR and AED, Chapters 5 and Chapter 6. I highly recommend that you read through those chapters either prior to or right after going through this presentation, just so that when you take your quiz, you're a little bit more prepared, because there is some information that we're not going to talk about today that I might skip over that is included in your exam, in your quiz. So we're going to start off with Chapter 5, which is CPR. We're going to talk about heart attacks and cardiac arrest, what's the difference between the two, caring for cardiac arrest, performing CPR, and airway obstruction. In Chapter 6, we're going to talk about an AED and how to use that. Public access defibrillation is giving defibrillation and how you do that and how the heart works. We're going to talk about care for cardiac arrest, using an AED, about an AED, some special considerations that you should take into concern, and then AED maintenance and supplies. And that will be the finish of Chapter 6. So let's start in Chapter 5, the heart attack versus cardiac arrest. So what's the difference? A heart attack occurs when your heart muscle tissue dies because its blood supply is severely reduced or stopped, usually caused by a clot in one or more coronary arteries. Okay, that's a heart attack. Cardiac arrest is when the heart stops beating. The heart might stop beating because of damage to the heart muscle. It might stop beating because of sudden cardiac arrest, of some other type of reason, but the heart will completely stop beating properly. Okay, sudden cardiac arrest is the leading cause of death in the U.S. Okay, that's pretty big. Most everybody that's listening to this today knows someone or has a relationship with someone who knows someone who has either had a heart attack or gone into cardiac arrest. All right, so caring for cardiac arrest. There is a chain of survival when someone goes into cardiac arrest. And you got to think of that chain literally like the links in a chain they all connect together. And those links help to increase the chance of someone who is suffering from cardiac arrest actually surviving that incident. So few victims experiencing cardiac arrest outside of the hospital survive without these links being together. Okay, so those links include recognition and action. That's you recognizing that the person is having a heart attack and taking action to care for that person. That includes calling 911 and making sure that advanced medical care is on the way to help that person get them to the hospital and get them the care they need. Okay, so there's the first link. The second link is cardiopulmonary resuscitation, CPR. We're going to talk about that in just a second. The third link is defibrillation, early defibrillation, as soon as you can get it to them. That's going to be your AED, either performed by you as a bystander or from the emergency medical system doing the defibrillations and transport to the hospital, or once they get to the hospital. The fourth chain is advanced care. That's going to be your hospital care, your nurses, your doctors, the people who are going to go in and are going to care for the person in more advanced ways than what you can provide. And the last link is what we call the post-arrest care. This is new. This is going to be that team who comes in after the incident, after the person has suffered the heart attack, and helps to recuperate them and get them to a better place to help them survive the long term and the stress that's going to come from that incident, from that cardiac incident. All right, so this is a more clearly defined of those 5 chains that we just talked about: recognition and action, CPR, defibrillation, advanced care, and post-arrest care. You can pause and read through those in greater detail, but we just pretty much talked about those before we moved on. All right, so performing CPR. There are age classifications for performing CPR. An adult is considered anyone who is puberty or older, like this guy right here. Okay, and these guys right here. Those are considered adults. Okay, children is going to be anything from 1 year to puberty. So that's going to be your infant, your toddler basically, and up to school-age children. Okay, and then infant is going to be anything younger than a year. So here's an infant. Okay. Those are your age categories. So for CPR, to start off with, you're going to check for responsiveness and breathing. Okay, so if you come up on a person and they are unconscious, laying on the floor, they're motionless, they're not making any movement. They might be making some sounds. You might hear some gargling or something like that, but they're motionless, they're unresponsive. You are going to check that victim. and you're going to tap them on the shoulder and you're going to say, "Can you hear me? Can you hear me? Are you okay? Are you okay?" If there's no response, that person is considered unresponsive. At that point, you are going to look, listen, and feel. At the same time as you're doing this, you're going to look, listen, and feel for breathing. Okay? Look at their nose, look at their chest. Is it rising and falling? If you don't see anything, listen. Are you listening? Do you hear any sounds that sound like breathing coming from that person? It might be a gargling sound, it might be a wheezing sound. If it's not a normal breathing sound, that person needs care. And then you might feel, okay? You might feel their chest to see if their chest is rising and falling. You're not going to take the time to actually check a pulse. You're just going to feel if they're breathing, okay? Now, if any of those things are not happening, then you're going to call 911 immediately, okay? If you're alone with an adult victim and the phone is nearby, go ahead, call 911 immediately, okay? If you are alone with a child or an infant, give CPR for 5 cycles, 30 compressions and 2 breaths. It's 2 minutes of care, and then call 911. Don't leave the child to go call 911. 2 minutes of care, then call 911. Okay, if it's an adult and it's nearby, leave them, call 911, get back to them. In most cases today, we all have cell phones in our pockets, or they're really close and nearby. So going to grab the phone and calling really quick is not always a serious cause, a serious hindrance. If you have someone else who's with you, then you can send them to call 911 and you can continue doing the care that you need. All right, so giving chest compressions. So now that you have got the victim, you've called 911, you've checked the victim, they're not breathing, you call 911, now you have to give chest compressions. So you have to make sure that that person is on their back on a firm, flat surface. Okay, you can't do this on a bed. They're going to be going up and down. It needs to be a firm, flat surface, the floor, the ground, something of that nature. You're going to place 2 hands on an adult, right over their clavicle. That's that hard, flat bone right in the center of your chest. And then you're going to use 1 or 2 hands on children. So for a child, a larger child, you can put 2 hands on their chest. On a smaller child, you're going to put 1 hand over the chest and 1 hand on the forehead, and then just give compressions with that 1 hand that's over the chest. Okay. For an infant, you're going to put 2 fingers over the sternum, and you're going to press with your fingers. There'll be pictures in just a minute to show you that. Okay. Effective compressions require rescuers to push hard and push fast. Okay. So the chest of an adult should be compressed about 2 inches, the chest of a child about 2 inches, and the chest of an infant about 1.5 inches. You're going to break ribs. It's going to happen. I'd rather have broken ribs than not be here. Okay, so it's okay if you feel ribs breaking when you're doing this. Okay. The desired hand position is for hands to be placed in the center of the chest, right above the sternum, right above that breastbone. Okay. All right. Also, you want your desired rate of compressions to be 100 compressions per minute. This is not the actual number that you're going to give, but just the speed of the compressions. So you're giving 30 chest compressions per 18 seconds. So it's going to be 1 and 2 and 3 and 4 and 5 and 6, and you're going to keep that pattern up until you get to 30. As soon as you give 30 compressions, then you're going to give 2 rescue breaths. So it's 30 compressions, tilt the chin back, and give 2 rescue breaths. Okay, those breaths should last about a second. So you're going to take a breath and then inhale 2 breaths into the person. Okay. Each time that you're going to take a breath, exhale into the person, take another breath, exhale into the person's mouth. Okay. Now, this is where that protective barriers come into place whenever we talked about ways to prevent disease transmission. If you have a rescue barrier available, use it for those rescue breaths. If you don't have one, then you just need to take protocol to clean up after you've given these cares, rinsing your mouth out, wiping down, using soap and water, those kinds of things. Now, you're going to continue this pattern of 30 compressions and 2 breaths until an AED is available, the victim shows signs of life, EMS personnel take over. That would be the ambulance, the police, the fire department showing up to help you, or you're too tired to continue and someone else takes over, or you've been doing it for a really long time and you're out in a remote area and EMS cannot get there and the person is beyond care. So performing CPR, giving rescue breaths. So we talked about the compressions, now we're going to talk about the breaths. When you give those rescue breaths, you're going to tilt the victim's head back and lift the chin to open the airway. So this right here. So head back, lift the chin. That's going to let the tongue lay down. It's going to open that airway and allow the air to get down into the person's lungs. Pinch the victim's nose and make a tight seal over the victim's mouth with your mouth. The reason why you want to pinch their nose is because when you blow into their mouth, if you don't pinch that nose, the air is just going to come right back out their nose. So you want to make sure to pinch the nose if you don't have a barrier that goes over the mouth and nose. You're going to give one rescue breath lasting 1 second. Take a breath and then give another breath. Okay, you're going to do that 2 times. You can use mouth-to-mouth barriers. It's exactly what it sounds like. This is a mouth-to-mouth barrier that she is using here. This barrier covers the mouth and nose. In some barriers, you have to, still pinch the nose and breathe in over the top of the barrier. Okay. Mouth to nose. If you're giving care to an infant, you might cover their whole entire mouth and nose, just because your mouth is going to be bigger than their mouth and nose. So you'll breathe over the mouth and the nose for an infant. You might also do this if you can't breathe into the victim's mouth because of some kind of an injury. You might just go ahead and cover their mouth and your nose with yours and blow in just to the nose. That will still get oxygen into the person's lungs. Or if you can't make a seal over the victim's mouth. You might even have a situation where you have a mouth to stoma. If a person has a stoma, to help them with breathing, you're not going to breathe into the mouth, you're going to breathe into this stoma, like what this is, but that's very rare cases. All right, so here's some pictures of what CPR looks like. So here's this woman, she's checking for responsiveness. Are you okay? Are you okay? No response. She's look, listen, and feel. She sees no breathing. She feels no breathing. She hears no gasping. This woman is calling 911, okay? And now she's going to put her hands over his chest and give 30 chest compressions. You see how she's sitting up tall. She's not sitting on her bottom. She is standing up tall with her arms locked, giving strong. Remember, those compressions are going to go in for adult. She's going to compress down 2 inches, and she's going to count to 30. 1 and 2 and 3 and 4 and 5 and 6 and on and on and on until you get to 30. Then she's going to tilt the chin back and give 2 rescue breaths. As soon as she's done with those 2 rescue breaths, she's going to be back to the chest and give 30 more compressions. She's not going to stop that until EMS arrives, an AED arrives, she becomes too tired, someone as trained or more trained than her takes over, meaning another bystander, or the person begins to respond. All right, so here's for a child. Check for responsiveness. Remember, with a child, you're going to give, if they're unresponsive, you're going to give 2 minutes of care and then call 911, okay? Or have a bystander call 911. Here, she's giving her 30 chest compressions, so 1 hand's on the forehead, 1 hand's over the chest. Okay, still giving 30 chest compressions and 2 breaths. And now she's tilting the head back. She's pinching the nose to give those rescue breaths. And she's going to repeat this process over and over and over again. And here's for an infant. Check for responsiveness. If there's no response, 2 minutes of care, and then go call 911. Okay? Instead of her whole hand, or the heel of her hand, she's putting her 2 fingers, her middle finger and her index finger over the child's sternum, giving 30 compressions, and then 2 breaths. She's covering the mouth and the nose to get those breaths into that baby. Head is tilted back. All right, so let's say you're giving care and someone has something that is obstructing their airway. They're choking, or you just don't see the chest rise and fall whenever you're giving those breaths. So an object lodged in the airway can cause a mild to severe airway obstruction. You need to know that. An object lodged in the airway can cause mild or severe airway obstruction. Okay, so a mild airway obstruction is good airway exchange is present. The victim can make forceful coughing efforts. The victim should be encouraged to cough in this instance. So if the person's making noise, if you can hear something coming out, if they're gasping, if they're wheezing, if they're able to still cough, that's a mild airway obstruction. They're still conscious. You want to encourage that person to continue coughing. Just pat them on the back, keep coughing until the object comes out or the person is no longer able to make noise. Okay, so then it turns into a severe airway obstruction. So you have poor air exchange, breathing becomes more difficult, weakness and inability to cough, or speak or breathe. Your skin and fingernail beds and severe inside of the mouth might turn blue or purplish or gray. That means that you're not getting oxygen in. In that instance, if they're conscious, we're going to do what we call, we're going to do the Heimlich maneuver, or we're going to provide care for a choking victim. Okay, so check the victim. Okay, ask, are you okay? Obviously they're not. You're going to perform the Heimlich maneuver. So what you're going to do is you're going to take your hand and turn it into a ball. Okay, now when you look at your hand, your thumb's on the bottom and you have your fingers curled in. When you look at your hand, it kind of makes like a little face. So if you like open it up, you could kind of have a little talking face. That's the way I think of it. You're going to take that talking face and you're going to stick that into the person's stomach. You're going to take your index finger of your one hand and you're going to find the belly button and then come up 2 finger widths. Okay, then take that face of your hand, the inside of your fist, place that inside right on top of those 2 fingers, and then take those 2 fingers off and place them on top of your fisted hand. Okay, that's your positioning. You can see him here finding with his finger. He's going to come up 2 finger widths above and stick that fisted hand right inside his stomach. There comes his hand around. Okay, and he's going to do upward thrust, forceful upward thrust into his stomach to help push out whatever is obstructing his airway. Okay, you're going to continue giving these thrusts until whatever is in that whatever is blocking their airway is thrust out. They're able to start coughing on their own, and then you're going to just continue to encourage them to cough, cough, cough until whatever is in there comes out, or they become unresponsive. Should the person become unresponsive, you're going to begin chest compressions, just as if you were giving CPR, because that force of a chest compression is going to help push out whatever is obstructing their airway. You're also going to check if that person, if you're giving those compressions, you're going to give 30 chest compressions and then look in the mouth to see if whatever was blocking the airway has now come out and is in their mouth. And then you're just going to do a finger sweep and get that out and just continue chest compressions until they come to. Let's say you have an unresponsive infant. You're going to support the infant's head and neck. You're going to lay the infant flat down on your forearm, okay? And then you're going to lower the arm to the leg. So you're going to kind of sandwich the infant. You're going to support their chin, and you're going to sandwich them between your 2 forearms, okay? You're going to lay them across your knee, and you're going to give 5 back blows right on those shoulder blades, forceful back blows to help force out whatever is there. Then you're going to sandwich that victim, that child again, that infant, between your arms, roll them over, and then you're going to place 2 fingers right on that sternum, just as if you were going to give CPR, in case you're going to give impressions, and you're going to give them 5 chest thrusts, just like you would if you were giving CPR. Okay, I'm just going to repeat that until whatever the infant is choking on comes out and the infant is able to cough and breathe, or until the victim becomes unresponsive. All right, so if at any time the victim becomes unresponsive, call 911, begin CPR. Look for any objects in the victim's mouth during CPR. All right, that's the end of CPR. So now we're going to move over to the automated external defibrillation, AED. Okay, so a victim's chances of survival dramatically improves through early cardiopulmonary resuscitation and early defibrillation with the use of an automated external defibrillator, or an AED. AEDs must be used in first few minutes to be effective. Okay, so that's one reason why you see those things around. Next thing you're walking through Memorial Gym, you're walking through a hospital, you're walking through one of the buildings on campus, you're walking through your school if you're off campus, and you see, you might see AEDs. Airports have them a lot of times now, and you're going to see a little box on the wall and it's going to say AED. Familiarize, if you're in a building and you know that you have an AED, familiarize with yourself with where that AED is, so that in case you do need it, you know exactly where it is. When I worked in Austin, we had a situation where we had protocols in place. Is even if the person, just about any time we had someone who had a medical emergency, it was protocol to just grab that AED and take it with you. Because of an incident we had a man who was on the walking track. He was a pretty far distance from our building. He was walking on our track one day, and we had a outdoor walking track, and he had passed out. Some people walked by, saw him, didn't know that he was in distress, casually walked back up to the building and said, "Hey, there's a guy on the track. I don't think he's doing well. I think I should send somebody down there to check on him." So because the people weren't very concerned, our staff responded. They got to him, which again, he was a pretty far distance from our main hub, our main desk where they were working. They got to him immediately. When they got to him, they realized that he needed that AED. In that instance, one employee stayed with him and was providing care to him, giving CPR to him, while the other employee had to run back to the building to get the AED, come back come back to him so that they were able to put the pads on him and give him the electrical shock that he needed. And in that time frame, just that length of time that it took him from running back and forth, the man unfortunately passed away. It was determined and told to the people who provided him with care that it would not have made a difference, that he had already died before they were even able to get the AED on him. But in those employees' mind, in those bystanders' minds, that little bit of time could have made the difference between life and death. So after that incident, it became normal protocol that anytime you had to care for someone, if you had not seen the victim, the AED was brought with you no matter what. Even if it was a broken bone, we knew to bring that AED with us every time. Okay, so know where an AED is in your facility, just in case you have to use it, especially if you work somewhere that you know has access to an AED. And if you don't have access to an AED and you work in a facility that has people who are working out, or you have people who are being active, or you have senior adults in your building on a regular basis, I highly recommend getting in touch with your supervisor and requesting. There are grants that you can write on a regular basis that will provide you with free of charge AEDs that you can place in your facilities. So I highly recommend it. If you have questions about that, you can get in touch with me and I can help you figure that out, just so we know we can get you an AED in your facility if you need it. All right, so when giving AED, when using an AED, kind of helps. We talked about the human body last week, but to talk a little bit more about how the heart works. We remember from last week that the heart is a hollow chamber. There's 4 hollow chambers within the organ. Those 2 chambers are broken off into the right chambers and the left chambers. The right chambers receive blood from the body and send it to the lungs for oxygen. The left chambers receive freshly oxygenated blood from the lungs and sends it back out to the body. Okay. Now, the heart is an electrical system. Okay. There are nerves in there that tell that heart to fire. Okay. The heart contracts approximately every second. And the heart needs abundant oxygen to be able to supply oxygenated blood throughout your body. Okay. So there are some differences in electrical activity when it comes to the heart. You need to pay attention to these. You need to maybe pause and write these things down, because I will tell you they will be on your quizzes. Ventricular fibrillation, or VFib, is the most common abnormal heart rhythm in cases of sudden cardiac arrest in adults. It's marked by, these are called an EKG. Okay, this is a reading that tells you what the heartbeat looks like. It's marked by an organized wave of electrical impulses is lost, so it kind of looks scattered. There's not really a clear pattern of what that heart rhythm looks like. This right here is a normal heart rhythm. This right here is what VFib looks like. Okay, ventricular tachycardia, or VTAC. The heartbeat is too fast to pump blood. This is what a VTAC is going to look like. Okay, it's pumping way too fast for the blood to actually get oxygenated and send oxygenated blood through the body. So VFib and VTAC, know those. All right, so to care for cardiac arrest, when the heart stops beating, the blood stops circulating, cutting off all oxygen and nourishment to the entire body. So when you give compressions, you're forcing the heart to beat. When you blow air into the person's body, you're supplying them with oxygenated blood. Now, it's not pure oxygenated blood, but it is the best they can get at that time. Okay, so time is crucial. And CPR is the initial phase of giving cardiac care. Okay, so an AED is the electrical device that you use. It analyzes the heart rhythm. It delivers an electrical shock if necessary. It corrects one of the abnormal electrical disturbances. So it'll help if someone has an abnormal heart rhythm, it can help reset the heart's electrical rhythm and allow that heart to start beating normally again. Okay. There are 2 pads that attach to the victim's chest, those electrodes. If you look on those pads, it actually shows you pictures of exactly where you should place them. One goes to the left of the heart, and then one goes on the right side of the body. They're going to show you exactly where you're supposed to put them. And it also has a built-in rhythm analysis system, so it can actually read the heart rhythm, and it can tell you whether the heart actually does need a shock or not. Okay. There's also a system where it can record data, so that when EMS gets there, they're able to download that. You take that AED with you, and they can take that to the hospital, and they can actually download that information and see exactly what the heart was doing from the point you put those pads on and you turn that machine on. They can gather that data and use that information at the hospital. All right, so here's some common elements. Most AEDs, actually all AEDs, are going to have an on-off mechanism, okay, a little button. They're going to have these cables, and they're going to have pads. Now, some places, some AEDs are going to be adaptable for children and infants. Just make sure that you're using the correct. Not all AEDs are going to have the adapters for infants and children. Just make sure that you're not using adult-sized pads on a child or on an infant. Okay, if you don't have that available, don't use that AED, because it'll deliver too hard of a shock, and it could cause more damage than good. Okay, it can analyze, and it will give a defibrillation. Okay, it gives you prompts. It will tell you exactly what to do. Okay, all of these machines are battery operated, so the batteries do need to be checked regularly to make sure that they still have enough juice to work when you need them. All right, so using an AED, only use if the victim is unresponsive and not breathing. Don't put this on someone who is responsive and is talking to you. It will hurt really bad. It can cause serious damage if you use an AED on someone who is responsive and is breathing. Okay, so you're going to turn on the AED. After you turn it on, you're going to apply the pads to the victim's bare chest. Okay, so most AEDs will have a razor or something, a pair of scissors, so that you can shave away, if the person has hair on their chest, you can shave that away so that those pads will stick better. They're also going to have scissors so that you can cut the person's shirt if you need to. Remember, this is one of those scenarios where you're going to want to provide care for the victim. So if you have a female victim, think about the people that are around you, and make sure that anyone who doesn't need to be there is not there whenever you're doing this. Okay, so once you've put the pads on the victim, you're going to push that button, and it's going to say stand clear. Okay, don't touch the victim. Okay, allow the device to analyze the heart rhythm, and it will tell you shock advised. Press the whatever button, red button, whatever. You're going to push a button, and that button is going to give the shock. Okay, as soon as you're done, as soon as it tells you to, it will prompt you to begin CPR. You're going to start right back up with CPR after that first shock, and that machine is going to continue to prompt you through the system. It's going to tell you give 30 compressions, give 2 rescue breaths. Then after it's had chime, it's going to reanalyze the heart, and it might call for you to push the button and give another shock. And you're just going to continue following that machine's prompts until EMS gets there. Okay. All right. So some special things to think about with an AED is water. Don't use this on a victim who's in water. If there's a puddle of water, get them to a dry place. And you want to use a towel or the victim's shirt to dry off their chest before you put the pads on. Make sure if you're using it on children, here's a pediatric adjustment set. It's got a little, they're going to show a child, and they're probably going to have a little bar like this on there that's going to adjust the shock. Okay. It's also going to tell this machine that this is for a child, and it will adjust the shock. You also want to look for medication patches. If you see any on the victim, remove those. Also, you want to look for implanted devices like a pacemaker. This is a pacemaker in someone. Avoid using electrode pads over that device. So if you have someone who has a pacemaker, don't put it directly over that. Switch sides. Okay. Allow the unit to stop before using the AED. So you want to actually, this is going to have to be turned off, and there's a method for turning that off. All right. So let's say you're the person who's in charge of caring for an AED and making sure that the supplies are there. They should be inspected periodically. Like I said, you want to check the batteries and make sure that the batteries are still in use and still working good, so that when you need it in an emergency, it's ready to go. There's some supplies that need to go into there. Make sure that the pads are sticky and that they're working and that they're going to be able to stick to the person's chest when you need to use it. Make sure there's extra batteries, that they charge, and there are extra batteries. You're going to need a razor, a hand towel to dry them off, a set of scissors, and then a breathing device is considered good to have into your AED. So if you need a breathing barrier or something of that nature in there, and then also exam gloves are also good to have in your AED. All right, so that is the end of this section, chapters 5 and 6. Like I said, either before you started listening to this or after, read through your chapters. Once you've done that, you'll be ready for quiz number 3. If you have any questions, just send me an email, give me a call in my office. I'll be more than happy to answer any questions that you might have. Have a good one, and I will talk to you next week.